Good morning and welcome to the Windsor-Essex County Health Unit's media briefing for Wednesday, October the 6th. We have no opening statements this morning, so we will go right into media questions. Any questions from AM 800?
I know we touched on this on Monday in regards to extracurricular activities, and you mentioned there was still a pause on it. But yesterday, the public board trustees voted in favor of working with the health unit to see if they can get started. I believe there's a meeting later today. Is your message going to be the same? Continue to keep them on pause?
Well, we always have dialogue and continue to have dialogue with school board officials. And when we meet with them, we'll discuss the whole range of public health measures as they relate to schools. A couple of things to think of, though. One is that there have been more classes or cohorts, as we'd use at the Public Health Service, of young people who have been excluded from school because of COVID exposures this year, in this brief part of the school year, than all of the fall semester last year. We've had more school closures this year than we've had in the fall semester of last year. So the burden of COVID-19 to school-age young people is greater this year than it is last year. And by looking at the indices or the metrics, it's probably quite a bit more. Our goal is to try to limit the spread of COVID-19 in the community and in schools. And we at the Public Health Service, and I think most people in the community agree that keeping schools open for instruction is probably the most important priority. And so we'll continue to work with the school board to try to effectuate a plan based on that. The Public Health Service, we're charged and we're regulated under the Health Protection and Promotion Act. And that act requires the medical officer of health with the Public Health Service working together to try to formulate the best plans based on the data and our local experience. Our local experience in Windsor-Essex is that COVID-19 has disproportionately affected this community right from the very beginning of the pandemic. So sorry for that long-winded answer, colleagues, but anyway, I'm glad to share my remarks.
Thanks, Dr. Nicole. Just in regards to the vaccination certification program, 2 weeks now, I know there was that blitz the first weekend. Overall, have you been hearing from your team? How are things going?
Overall, things have been going well. Overall, I think most places are adhering, to the requirements and for proof of vaccination. We do receive complaints and follow up on those for businesses that perhaps aren't following the requirements to require proof, and in some cases, we provide education, and where necessary, we will lay charges.
Is the education period all done now, or are you still providing that education?
There's always an education period. The education is never done. We use a progressive enforcement approach, and part of that progressive enforcement approach is education. So, our officers are looking for, how things have been implemented. They're working with businesses to problem solve. They're looking for due diligence, and so education never stops. It's always part of our process and plan.
Thank you.
Any questions from CTV?
Yes, good morning. Has the health unit identified any hotspot postal code areas to use for the rapid antigen screening program for students?
Well, the framework for, and I think the memorandum was released yesterday, is that the framework for using rapid antigen testing would require an identification of specific strategies, and only under very limited circumstances would it be an appropriate approach. We continue to have dialogue with the school board and to make determinations of that nature, but we've not made any specific determinations at this point. I think it's important to consider that testing, especially testing of asymptomatic people, has a very limited role in the management of the pandemic. And the reason is that when you screen people, who don't have symptoms, you're likely many times to have people test positive who in fact don't have COVID, and that can be a significant problem from a public health point of view. So just to encapsulate my comments, we will consider all the options that are potentially available to manage COVID-19, and that would include testing in the appropriate circumstances. But we've not made any firm decisions regarding school testing, and we definitely have to do that in cooperation with our school board colleagues.
Okay, thank you. Now for a couple of non-COVID related questions. How concerned are you about the rise in sexually transmitted infections, and what do you think the reason is for the increase in the community?
Well, we're always concerned about communicable diseases and communicable diseases that are sexually transmitted are concerning for a whole variety of reasons. We can have someone. I could speculate today about what the potential reasons for the increased case counts might be, but perhaps you could send an email to the health district, and I'll have the epidemiologist review if we can actually make any scientific inferences on what the basis for that increase might be. Nicole, if you want to supplement that, I haven't seen recent data on the causation just yet. So,
yeah, I think we could have our team provide a more accurate response. But we do know, there's certainly over the past year or two changes in behavior, and certainly also changes in the availability of services and the promotion of certain preventative services. So certainly that's something that we consider as part of this. But we can have our team provide a more accurate response.
Yeah, it's an important topic for sure, and we just want to give you the right framework. We'd like to, perhaps we can comment even on the distribution of ages for sexually transmitted illnesses. At least in the past, there was a concern that sexually transmitted illnesses were also becoming a burden for the older part of the community as well. So let's try to give you the best possible information. If you send us an email, we'll try to get you a proper response.
Sure, no problem. I can do that. And just in regards to the overdose alert in the community, I know the health unit has been working with community partners on strategies. Is it disheartening to kind of see those numbers still increasing despite all the efforts that you've been making to try to keep overdoses down in the community?
Yeah, certainly. And I think we've said this before. We have been working very hard. I think the pandemic certainly has had an impact on some of our approaches, but certainly, this year we've seen more opioid overdoses than, any other year in the recent past. And that is, cause for concern. I know we talk a lot about COVID-19, but our team is still working very hard behind the scenes, as well as all healthcare partners, to tackle this issue. And, as you know, we are working towards establishing a consumption treatment services site, but as well, there's a number of other preventative strategies that are being worked on behind the scenes, in collaboration with health partners and being led by our other health partners in the community. But certainly we are concerned, and whenever we see an increase in a rise in opioid use or any sort of drug-related emergency services.
So if I could just supplement that, substance use is a real problem in our culture. COVID-19 has been the focus, but in fact, over the past 18 months, there are more people who died of opioid use than died in car crashes. In fact, I think it's many times more, and we could get you the exact numbers, but it's many times more people die of opioid use than in car crashes in this province. Secondly, the last time I looked at the data, about a half of all people who overdose and die at home. So one of the things that everyone can do is if there's anyone in your family, anyone in your household that you're worried about, get a naloxone kit. You can pick up an naloxone kit from all sorts of places, because it could be the opportunity to save a life. And so that's one thing that every one of us could do, is that recognizing that many opioid deaths happen at home. So those are two things that we could really try to encourage the broader community to do. And it's something you can do today if you choose to do it.
Okay, thank you.
Any questions from CBC?
Yes, good morning. I have a couple of questions related to mask policies in schools. First of all, are schools allowed to provide mask exemptions for students who say they're having a difficult time wearing a mask while working out indoors?
Nicole, perhaps you could answer that.
The mask policy or the mask requirement falls under the Ministry of Education guidelines that were created in consultation with the Ministry of Health for all schools. There are some exemptions within the mask guidance, and those are similar to those that are under the Reopening Ontario Act, and those would certainly be related to, medical reasons why someone couldn't wear a mask. In those circumstances, as a public health unit, we would recommend, caution be taken for anyone that is unable to wear a mask, within the school environment, ensuring that they have distance. And, I think you mentioned around physical activity, we'd be wanting to ensure that as much distance as possible is taken and other measures are in place to ensure the protection of that individual and others.
Thank you. But is there any kind of legitimate health concern with people, say in high school, doing physical activity indoors while wearing a mask? And also, what about someone who has asthma, for example?
So I could start, and then I'm sure Dr. Nezathuri may want to add. So our recommendations to schools around physical activity is to wear, for everyone to wear masks indoors. And to not consider the type of physical activity, like high intensity physical activity that would be, we wouldn't recommend wearing a mask for those activities. So our recommendation is for only those low intensity activities where a mask can safely, be worn by students, especially when indoors, because that environment is high risk. So that's currently our recommendation.
Yeah, the one challenge is that when people need individual level decisions, they should speak to their physicians, based on and the doctor and the patient can make decisions about the facts and circumstances of their disease, their clinical presentation, the appropriate level of limitations, and then make that decision. So it's hard to comment on specific individuals. The vast majority of people can wear a mask safely when doing regular activities at school. And so that would be my general impression. But as it relates to any individual patient, they should discuss that with their physician and make a judgment together.
Thank you very much.
Any questions from Blackburn?
Yes. I wanted to ask you, you kind of touched on this issue a little bit earlier, the rapid antigen testing. I guess, are there any schools that have had outbreaks here in the past where this sort of thing would have been helpful?
Well, I think there's a very limited role for rapid antigen testing. There are times I think that they potentially could be helpful. But for the most part, I think that rapid antigen testing would not be the preferred option in many school outbreaks. I think in any outbreak, you have to look at the facts and circumstances, and there are a number of factors that make a decision about what type of testing to do. The accuracy of the rapid antigen testing is less than that of the PCR testing. And so in an outbreak situation, I might be more inclined to recommend PCR testing than rapid antigen testing. So I think the bottom line is that you have to make a judgment in an outbreak based on the facts and circumstances. That includes the background prevalence of disease in the community, what one anticipates the presence of illness in that local school, and the technical capacities of the different testing strategies. And putting that together, we try to find a plan moving forward.
Am I to take it then that you will not be asking the ministry for rapid antigen testing here? It sounds like you've mentioned it's not your preferred option.
Well, all the options remain open in managing COVID-19, and so we would keep all the options open for the health district. But like everything else in medicine, we only employ investigations, tests, and treatments we think are appropriate for the circumstances that we're dealing with. And if the circumstances warrant, then we will keep that as an available option.
Okay. The other question I wanted to ask you is again about the school boards seeking an end to the pause on extracurricular activities. It sounds like, and correct me if I'm wrong, that you're not very comfortable with lifting that pause now. Is there anything the school boards could say to convince you otherwise?
Well, I think that I wasn't at the school board meeting, but as I understand it, the resolution was when the public health unit felt it was clinically appropriate or something to that effect. And so we agree on that. When clinically appropriate, we'll modify public health guidance based on the facts and circumstances moving forward. What I can share is that we continue to have discussions with the school board, and we meet with school board officials and we evaluate the data. And based on the data, we'll try to make the best possible recommendations we can for the community and specifically for the schools and the young people who attend schools. The decision to implement a suite of public health measures or to effectuate a group of public health measures is based on the local epidemiological data and the assessment of risk, which involves some level of judgment, and the health district has 300 people working on matters of this nature. So I think at the end of the day, we'll just have to continue to evaluate the data and make our best judgments moving forward. If I could share with you, doctors can't predict the future, so I can, as a generic construct, we just have to work with what we know today, and hopefully that'll give us the best possible plan moving forward.
Not to pin you down, but as of today, looking at the data today, would it probably be your suggestion during this meeting this afternoon that the answer is no, not now?
Well, we haven't had our dialogue with the school district, so any level of dialogue has some level of discussion, and based on that discussion, we'll make a recommendation moving forward. I've not seen the data for today as well, but one caution is always that one can't use one day's worth of data to make a judgment. I think you have to take the entire picture and try to make the best judgments moving forward. So I think we have to wait for the additional dialogue that we have today, and I wouldn't put too much, I think it's okay to talk about the discussions today, and there'll be discussions later on this week and discussions next week as well. The key thing, and this is the key message, the most important thing is to keep schools open for instruction. That's more important in my mind, and I think in most parents' minds, than anything else. And especially for elementary school children who I think have been deprived with schools closed. School closures, in part, are in part related to the background risk of COVID in the community, the number of young people affected by COVID in the schools, the number of outbreaks, the number of classes that are dismissed. So the more we can keep those numbers low or lower, then the more likely we are able to keep schools open for instruction. So that's the first, I think, key message. I think the second message is that anytime we increase human-to-human interaction in COVID, we increase the risk of transmission, because COVID is a disease that's primarily communicated by respiratory particles and respiratory droplets. Thirdly, schools are at a particularly high risk because a good part of the population of the schools are currently not eligible for vaccine. The vaccine is only eligible for people 12 and older. So that also modulates our risk. Also, this is a difficult challenge, but it's also the fact that we want to try to limit exposures in schools, not only for school challenges, but also to prevent the exposure from school children to their parents, to their grandparents, and then ultimately to vulnerable people. And we have had deaths in recent days, in recent weeks, with COVID-19, and those deaths include people that currently live in the community. So that's the public health challenge that we face. It's not just about extracurricular activities, but it's the fact that how does the aggregate, the amount of extracurricular activities in schools affect the school, the number of cases in schools and the number of young people in schools dismissed, and then ultimately how does it affect the broader community? So sorry once again for being long-winded on that, but it is more complicated than just extracurricular activities for sure.
Don't ever apologize for being long-winded. I don't mind, and thank you very much.
You're welcome.
Do we have any questions from a representative from Windsor Star? They joined. We did have a new attendee come in, possibly from Radio Canada. Any questions?
No, yes, that's me, Elvis from Radio Canada. I don't have any question. Thank you.
Okay, thank you. Any additional questions from AM 800?
Sorry, I have one, but Taylor from the Star, I think she's in the virtual waiting room. She just sent me a message asking if the newser is happening.
Oh, all right. I will get in touch with her. I have resent her the link. Thank you. You can go ahead with your question, Rob.
Okay, Doctor, just to the point from following up on Adele's question, will vaccination rates within that population be looked at before moving forward with extracurricular activities?
Well, I think that is one factor to consider. The higher the vaccine rate, the lower the risk of transmission in the population. So, clearly, from a public health point of view, would like to have vaccination rates higher among young people and among all people at a higher rate than it's currently at. So that's definitely something that we would use in our decision making and recommendations related to schools.
And speaking of vaccination rates, Nicole, obviously driving by the site at Devonshire Mall, some days the parking lot looks full, other days it looks empty. I guess, does it all depend on the day, or what have you been told? I know Windsor Regional operates that, but are there busier days than others, and is that why our vaccination rates are not really going up?
Yeah, they do provide us regular, daily updates, actually, related to the volumes at Devonshire, and they do fluctuate, Rob, you're absolutely correct, by quite a bit on a daily basis. I don't top of mind know which day typically is the busiest, but it can fluctuate by hundreds from one day to the next, and at any rate, we have capacity to do a lot more than within that clinic and see a lot more people than we are currently. And I think Dr. Nazathuri kind of started off this morning talking about the number of people that are still eligible to be vaccinated that are not. And so we continue to encourage them to take all opportunities, whether it's through the pharmacy, through their medical provider, and certainly our mass vaccination site. We are lucky as a community to still have one operating and have so many options for people.
Thank you. Have a good day.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Yes. Has there been another school closure? We noticed that there's no buses going to École Louise Charon.
Nicole, do you want to answer that?
Yep. So we are currently working with that school to manage an outbreak within their school. At this time, they don't have students attending.
Are you able to speak to any of the specifics of that outbreak? How many cases?
I don't have that top of mind. We have a meeting, with any school that has been impacted significantly, such as this. We do meet regularly and discuss. So I don't have any more specifics to provide you at this time.
Thank you. Sorry, one more question, if I may. I know that, Dr. Necessary, you've mentioned before that we've had, 200 cohorts dismissed. But do you have any plans to release information on how many classes are dismissed at a time, so we can gauge sort of where things are and compare?
Well, that's a public health unit policy issue. Maybe I'll ask Nicole to comment on that.
So just so I can understand your question, you're looking at the average number of classes dismissed by, so when we dismiss a cohort or cohorts, it's related to an exposure. And so you're asking for the average number of individuals or cohorts that are dismissed per exposure. Is that what you're asking?
Sorry, you're right. My question was unclear. What I meant was we have information about the overall number of cohorts dismissed, but we don't have the information on a weekly or a daily basis in order to be able to compare the past and the future, like how many cohorts are currently dismissed versus last week, for example.
I see what you mean. We can bring that internally and look at providing maybe as part of our EPI summary, a sense of the number of students that are dismissed on maybe an average on a weekly basis. The school boards all do report that information, so they will report the number of cohorts by school that they have dismissed currently. So that is one place that you can, access those updates, but we can look at providing that as part of our summary.
Thank you very much.
Any further questions from Blackburn?
Nope, I'm all good. Thank you very much.
Any questions from Windsor Star?
No, thank you. Sorry, I had some technological difficulties.
Any questions from Radio Canada?
Unfortunately, I joined a little bit late, so I'm just wondering when can we access the recording?
I will email the recording out immediately after this is closed down, so probably within the next 10 to 15 minutes.
Okay, sounds good. Thank you. I have no question. Thanks. Have a good day.
Thank you, everybody. So that will wrap up our media briefing for today. We will reconvene tomorrow morning on Thursday with our EPI summary. Have a wonderful day.
All right. All the best.
Thanks.
Thank you.
Bye-bye.
Thank you.